Hi, this is Dr. Ferris with Elite Spine, and I have one of my favorite patients with me, and I don't say that always.
Thanks.
This is Elizabeth, and I want to share her story because it's pretty common with the upper cervical work. She's been under care for over 10 years with upper
Mhm.
cervical work. She came, I'm gonna let her story, tell a little bit about her story with how she got started with it. And then we're gonna talk a little bit about some TMJ stuff and what the TMJ specialist noted with her uh, condition compared
Yeah.
to what he typically sees. So go ahead and share just a little bit what you were telling me about your daughter, how you got into
Yes.
it, and
So we lived in California, and my daughter has suffered. She's almost 40, but she had had back and knee pain for years and years, starting at 16. And she had a friend who was in a severe accident and had started to go to see a NUGA doctor in San Francisco. And so she thought she'd try it out and wanted me to come with her. And one thing led to another. We both were evaluated and we both started treatment. She did not continue with treatment. I have continued with treatment. It's a big commitment. I drove sometimes 3 hours round trip to go to San Francisco from where we lived on the peninsula just to go get treated. And I was going 2 to 3 times a week in the beginning. So it was a lot, but I'm thankful that I continued with it. Because when she complains about aches and pains, I say, I don't have any because I've continued to do this over the past 10 years.
and
So,
obviously the nice thing now is we've gotten you under such good control
right.
that we only have to see you, once or twice a month at
Yeah,
most.
exactly. Yeah.
And you are telling me that, and most of my patients tell me this, is that you start to know when
Yes.
things are starting to get off track,
Yes.
and you know that if you get in, pretty quick, like
Mm-hmm.
it's back under control, and your quality of life
Right.
is so much better.
Oh, definitely.
And so
Definitely.
that's been a nice thing, and we notice that with patients, and that's what patients are looking for is a long-term solution to their
Yes.
problems, not just take the symptoms away and let them come
Right.
back again.
Right.
What can we do to manage the condition at the root
Right.
cause?
And it works. I mean, I tell people about this and they're like, yeah, 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 but it's worked and it's worked for me. And I was saying earlier that I've had an evaluation done because I have some TMJ stuff. And the dentist that did this was stunned that my spine is almost perfect. And I really attribute this to the 10 years, the 10 years that I've been doing this and consistently doing this.
Yes.
And, when we moved back here, like I was saying, I was scared to death. I wasn't going to have anybody to go to. I'm so thankful you're here because I thought I was going to have to drive to Chicago once a month
Yeah.
at
Well, we're
least.
so thankful to have you a part of our practice and just
Thanks.
continue to keep your care great. And
Yep.
thanks for sharing your story.
Thanks.